Hey, eGP learners, and welcome to our live episode today on Saturday, the 12th of December. You got myself and Andy. How are we doing?
Yeah, hi there, Gandhi. I'm doing pretty well, thank you. Looking forward to an interesting episode and the festive season.
Definitely. And we've hopefully got an interesting one because we're now kind of at that precipice of the whole COVID vaccination program that many people in primary care have been talking about. So for this episode, we're just going to recap what's been going on and basically let you know what we've been up to and all the various different stuff around the COVID vaccination, because I know that's pretty much on the forefront of general practice's mind right now. I mean, they've started vaccinating people now, haven't they, Andy?
Yeah, we've had the first vaccinations in our region and around the country. I've been seeing people on telly receiving their first vaccinations. I even know people in the flesh who have received vaccinations. But yeah, Gandhi's had his. So yeah, we almost need have you got any celebratory music or anything, Gandhi, there? Because
I don't have it lined up, I'm afraid. But you got me on, threw me a curveball there. But hopefully next time we'll have it all ready and set. But yeah, it's been an interesting couple of weeks since last time we went live for everybody, and we did cover the safety and general practice kind of episode because we kind of took a break from COVID. But we had loads of other content going on in the meantime. I think the key thing is obviously, the vaccine's live, it's available. Hopefully some of our viewers have had the opportunity to either have it or definitely, I'm imagining, involved in the delivery of the vaccination, whether that's through main hubs or at the very least looking at how they're going to deliver that from practice, because I know you and I have massively been involved in that side of things as well, haven't we?
Yeah, from the primary care network perspective and wearing those hats. It's been an interesting journey locally. We can talk about our local experiences later in the episode, I guess. Yeah.
Sure. And so, should we? Yeah. So the sign-up process, how's that been? I mean, it's been a big thing, hasn't it?
Gandhi, I want to dive in. So you've had your vaccine.
Sure.
And so you must have been through the process of signing up to have it, going along. I've yet to sign up. I've sort of in a way I sort of dragged my feet a little bit and didn't get in before it became a lot harder to get yourself signed up for the vaccine. So I didn't get in there. And in a way I consider myself a little bit lower risk, being hopefully younger and due to my ethnic group and not having other medical issues or living with other vulnerable people. So I'm sort of happy to let other people go at the very first tranche. But you signed up. So Gandhi, how was the process? Start to finish. How have you found it all?
It's been all right, actually. So Nottingham have been providing their vaccinations for those at risk, and that includes healthcare workers from the Queen's Hospital, and I think one of the other hospitals, Kingsmill, a bit further away. Process was pretty simple. So link went round, you sign up. I am aware that the website crashed within like 24 hours of it going up. And I'm assuming that's a number of people signing up and then making sure that they don't end up having people turn up when they don't have capacity to deliver it. But the process was all right. Website was very basic. Okay, fair enough. They cobbled it together and they had to. My only comment on that would be it'd be nice if it looked a little bit better and worked. One thing I really found annoying is that it kept saying you haven't put your gender down, and I couldn't actually see the box that said how to add your gender. It was a tiny little line that was kind of hidden. But once that was done, it was sorted. I got an email to confirm my date and everything. Went over and had it done yesterday. And yeah, it was fine. I got greeted, checked I didn't have any COVID symptoms, or it was appropriate to have it. They went through the consent process with me. I then had to see one of the consultants who signed the prescription, because we're still yesterday in the PSD format. And I know we're going to talk about PSDs and PGDs a little bit later to explain that. And then, yeah, sat down, had the jab, and had to hang around for 15 minutes afterwards, and I was all right to go home. And I did. And here I am.
Excellent. Gandhi, when we were talking off camera, you said that you'd sort of had what I think you thought could have been a little bit of a sort of a strange sort of panic attack type thing. And I don't know whether you were going to share that on camera, but I thought it was quite interesting, actually, just as, as a healthcare professional, because people who aren't healthcare professionals might have similar things, perhaps think they're having a reaction when they might not be. Sure. Are you comfortable talking?
Yeah, I think simply explain it. So in going through that process, you have to talk to so many people till you get to the point where they actually inject you. So you talk to the person who greets you, who says all the different things they have to say. Then there's the person who actually does the consent. So it was one of the nurses. So, she spent a bit more time going, you wear this, yeah, fine. had to go through it again with the person who prescribed it, and you know, I think he was a bit more open to the fact that, you know, I kind of knew what was going on. And then obviously there's the ID check when you have the vaccination. Well, whether it was just that whole environment, you know, I was fine. I'll be very clear on that point. You know, it was just that momentary, oh, what's going on? And then a few seconds later, I was all right, and I was like, actually, am I just, you know, is this background anxiety? Is this something else? As I was sitting there afterwards, you know, waiting my 15 minutes before I could go, like, okay, I was on my phone, so I was fine. And I think, you know, many people may feel that kind of stuff because it is something that's different, something that's new. I've not had to go through the whole consent process for anything medical for a long time. So I think that partly was, you know, just, it's that constant reminder, isn't it? You know, people keep asking, are you sure you want it? Are you sure? And they're like, yeah, I'm sure, I'm okay.
Yeah, am I missing something here? Should I not want it?
Yeah, it's that weird kind of why, but it's the process, unfortunately. You know, that's what we have to, it is a new vaccine. There is, you know, that element of making sure people are happy with it and that it's appropriate to do and all that kind of questions. And we know that some of those things have had to evolve over the past few days, even since the vaccine went live. So like we talked about, the 15-minute wait time has now come back in. The anaphylaxis requirements, making that absolutely clear because of, you know, a couple of things that have happened in the past few days. But it was all good. I'm fine now. I'm slightly achy arm, I must admit. So some of the very common side effects are that you may have local discomfort at the site of infection. And the best way I can describe it is, imagine if you've just been spent the half a day wallpapering a room. That's kind of what my arm feels like. It's not as bad as the typhoid one. That's the worst one I've ever had, I must admit. That vaccine really made me sore.
At least you know it's doing something, Gandhi. That's good. Yeah. I think it's interesting observations about the consent process, and obviously it's important that we make sure that people are informed of all of the negatives and so forth. But I sometimes wonder if inadvertently the process is set up in such a way to build so much tension for people that it actually makes it unpleasant and causes a little bit of harm in terms of panic. So at some point, I wonder if it's worth looking at how, you know, how we do consent and how we might make it easier. But there's some pointers later in the episode, isn't there, around that?
Absolutely.
So that's good.
And I guess I'm interested to know if any of our viewers have had or booked in their COVID vaccination. You know, if you have, and if you've had any of these kind of thoughts or concerns, let us know in the chat. I'm more than happy to try and answer it and stuff. And just a reminder, we are live. So if you are joining us live, hi, I hope you're doing all right. And if you're watching us on the recorded thing, still let us know in the comments. What do you think? What were your thoughts and stuff? But yeah, we are moving through what is this unusual process, and obviously from next week in particular, that they're opening up who's going to be able to have the vaccine a little bit more, so moving down that priority group list and stuff. And I know there's definitely an aim to try and push down to things like the care home residents, you know, those most at risk in terms of the priority groups and things. It's been interesting though, hasn't it, Andy, in terms of the coordination and the kind of logistics aspects of it?
Yeah, I think so. I mean, I think at this stage, there's only one type of vaccine available, and that's the Pfizer vaccine, which has quite unusual characteristics as a vaccine. We've talked a lot about this at length before, but it requires storage at minus 70 degrees Celsius, has to be used quite quickly. I think, is it 3 days now within thawing?
Yeah, so they've originally people were told it's 5 days, and that's because it's 5 days in totality. But in actual fact, they've limited that to 3.5 days to ensure there's no wastage. Because that's the thing many people are concerned about. We don't want to waste the vaccine, because it's important that we get the most out of what we've got. And there is a massive push to try and reduce wastage as much as possible. So yeah, it is a bit tighter, I think, and I think we'll see how that works.
It's limiting the rollout to these sort of large regional centres currently, isn't it? So as you say, we've got Queen's Medical Centre, which is in Nottingham City, and we've got Kingsmill Hospital, Kingsmill Hospital, which is in Mansfield, and really those are the only places that vaccines being delivered from at the moment. I think the hopes are that when the more stable, more traditional vaccines with more normal kind of characteristics that we're used to in terms of their storage and transportation come online, hopefully in the new year, the AstraZeneca vaccine and the Moderna vaccine, that we'll be able to perhaps move to more sites, and that's when probably primary care networks and general practice begins to play a bigger role in vaccine development. So yeah, it's a strange time, but it's great to see those first jabs happening before Christmas, which I think is actually probably just at the most optimistic ends of what people were predicting,
Yeah.
earlier in the year and when COVID started?
Although one thing I will say, I get the general impression that the national media and the kind of the message being pushed out may not be reflecting that. And the reason why I say that, so I was interviewed for one of the radio networks yesterday in terms of the primary care response, and the general impression I had, and the interviewer had as well, was that general practice is going to be delivering this from next week. Yeah, and
that's the impression I've got from the media. Yeah,
exactly. But it's not the reality. Yeah, I think in some places they have set up that the hubs will be from practice sites. So I know there's definitely some of our amazing colleagues within PCM working and stuff that have been able to set it up so that they can deliver that from a local site in their areas and things to patients. But it's definitely not going to be the case that every GP practice across the country is going to be delivering the vaccine from next week. And I think, to be honest, the national media and the government have some responsibility to play here. They're pushing the wrong kind of message to say that. Definitely keen that I think many practices can do that. And I know many practices are keen to do that. But there has been this element of, unfortunately, yet again, some miscommunication going around in terms of, what is available, what's going to be available, and what's realistic. I think. I don't know if you felt that, Andy.
Right, Gandhi. Let's go down this little mini rabbit hole. Actually,
all right, rabbit hole time. Let's go for it.
I'm curious to know what you think about it. I think this is where I need to make myself a tinfoil hat to put on when I go into conspiracy or theory mode. But I'm really interested. So I've had that impression from the general media as well. And whenever I've seen GPs, for the most part, interviewed on national, not local, on local and regional media, people are more realistic. But on the national stage, whenever I've seen GPs interviewed or a camera crew at a GP practice over the last few weeks, the message I've seen is, oh, we're ready to go. We're ready to go. We're about to start. We can do this, no problem. General practice is going to deliver this. And I'm just wondering how that has happened, because I know the RCGP, has a, plays a role in, communication with the mainstream media outlets. And, traditionally you see a lot of RCGP representatives, or you have seen a lot of RCGP representation on those media platforms. I have seen members of the GPC, I think, giving a more moderate view. But I'm just wondering, how does this happen where the general impression is something which I don't think reflects sentiment within the profession? Is number 10 and the and NHS England driving their own agenda, which is not the same as the colleges and the BMA? Should the colleges and the BMA be trying harder? I don't know. What do you think on that whole issue? I feel someone's pushing our buttons, basically.
I kind of feel that all the time, don't you? The narrative of what happens in general practice in terms of what seems to happen from the grassroots and what happens from the representative elements sometimes align, sometimes don't. And I think that's something that, our representative bodies need to be listening to. We've commented the pros and cons of the RCGP in terms of being a representative organisation numerous times. We've commented recently in terms of the GPC and how that's worked, in terms of particularly the COVID vaccination and that kind of thing. I think it's also difficult, isn't it? Because you want to try and be positive and you want to try and show that general practice, which can do some amazing things, and it really has. And let's be clear, there are some areas in the country where the vaccine will be delivered from hubs, which are going to be either practice-based or next to practices, because I know some of our colleagues have managed to arrange that. That's not going to be the case universally. And I think that's the part where it often falls down, because there is this expectation that general practice is doing something, and it is. Because let's be honest, we're pretty good at what we do. There's a reason why general practice still functions and does 90% of the NHS workload, because we can do it. But I think there is also that element of trying to push the message that actually that isn't always going to be the case everywhere, because everywhere's different. You take us, okay? My practice building potentially has the ability to deliver the COVID vaccination, but not really the Pfizer one, because we don't have a freezer that can store, a vaccine at under minus 70 degrees C in our building, and the workflow that means that we can have people, have that vaccine and still do everything that we're meant to do. Now, That doesn't mean that we won't be supporting our patients to have the vaccine. We will be, but we'll be doing that in collaboration with other people, and that will be delivered from somewhere else, not from my practice building. And that's the distinction that isn't really being pushed out clearly.
Yeah, no, I think you're right. Yeah, maybe we just need more balanced representation, and perhaps those GPs that do appear on the media talking about what they're doing in their local area perhaps just need to, if there's any of you guys out there, just bear in mind that whilst you might be set up very well to deliver something, other people might not, and it may be worth just mentioning that when you're interviewed. Although, being said, I've been interviewed before, and you have, Gandhi, and what you tend to find is you talk sensibly about something for about 15 minutes with a reporter, and then what's actually presented to the public is about 30 seconds of a soundbite of a part of what you've said that can be a little bit unbalanced. So maybe people are being more balanced and we're just not seeing it. But there we go. Gandhi,
context is often hard to share, isn't it, Andy? That's the thing. And we've seen that in the past year as well. But if you guys want to hear more about that, join us for our recap episode that'll be coming out in the next week or so.
So Gandhi, there's a few key developments that we identified before going on air, which we could perhaps just go through, really, I guess.
Let's go for it.
These are things that we've thought have been significant over the last year or so. So the 15-minute thing. So a few things happened locally, didn't they, Gandhi? I think we had a few anaphylaxis cases. I'm just finding the right. There we go. So we had a few cases locally. I think, was there one at QMC and one at Mansfield where there were some anaphylaxis reactions associated with the new vaccine? Very, very rare response. And obviously there's a lot of vaccine being delivered around the country. But I don't know, did you want to talk to that? I've got the 15 minutes up.
I think we've had, so we know nationally there's been a couple of patients that have had reactions and stuff. And, in terms of what that's meant is that as a result of that Public Health England, I think, apologies if I get this wrong, I'm not quite sure who's made the decision. Actually, sorry, it's the MRHA who licensed say that we can use the vaccine, have said that actually there needs to be a 15-minute observation period following the vaccination minimum. So depending on individual health issues, that may need to be longer. But the minimum is 15 minutes that people are being asked to hang around and just to observe to make sure they're okay. And I guess part of the challenge with that is that massively affects the way that you can flow people through a system, because suddenly you've gone from, jab the person and they're okay to leave, to having somewhere where they can wait for 15 minutes. If you're trying to get, 100 people done in an hour, which I know is what some places were trying to do, and potentially even more, that's massively affects your flow. And having this space to do that in social distancing, because don't remember, we still have to have 2 meters apart for everybody once they're hanging around and things. So, that's a massive thing, I think, that's going to impact how a lot of the clinics and the locations and all that kind of stuff change, which wasn't originally there when the specifications came out. So that got adjusted over the weekend this week. And that got adjusted. And I think how that works for many places, they're going to have to adapt, because that is the requirements. And that's the key thing. One of the things that I've seen loads of places, people saying, do we have to do it? Don't we have to do it? MRHA says you have to do it. Whether you like it or not, you have to do it. So it's figuring out how that's going to work for each area. And this is in relation to anaphylaxis. You need to make sure that people are safe. And that's the second thing that came in, that if you've had a past history of anaphylaxis, if you've had, severe allergies, if you're required to carry an EpiPen with you, then, on the grounds of safety, they're saying that you shouldn't be having the vaccine, because it's difficult to know how you will respond to it. And therefore, we're trying to keep as many people safe whilst trying to vaccinate as many people as possible, I think.
Yeah, absolutely. So that's one of the developments over the last week. The other thing was there was, and this was, I think the deadline was midnight on Monday, the 7th.
Monday evening, yeah.
Was the deadline for GP practices to sign up to the COVID vaccination enhanced service, something that we've talked about a lot on the podcast and YouTube channel before. And there was fairly good sign up locally, but some practices around the country and some areas around the country have not signed up to the COVID vaccination enhanced service. And NHS England are apparently reaching out to groups at the moment. We get a lot of our news from Pulse, thanks to you guys, and we're displaying some of your stories here today.
Yeah.
And so it's interesting. I know that and maybe we'll talk in a few moments about the local sign-up process, because it was pretty close to the wire locally, and there were quite a lot of discussions about whether or not it was a good idea, and actually whether signing up or not best served our patients, given the presence of another vaccination plan locally. But it's something that it might be quite difficult for the general public to get their head around, that GP practices might not sign up to deliver COVID vaccination. So what do you think about this, Gandhi? I've not seen it reported actually that widely in the general media. Actually, I thought it might make more of a stir, but obviously those people that control our media lives and agendas haven't picked up on this yet.
Tinfoil hat going back on there, Andy.
They're obviously driving other things at the moment. What do you think about the decision to sign up or not, Gandhi? And
I think there's various things that go into those decisions, and absolutely what we've tried to share with many people, this is a practice-based decision, because the practice is signing up to deliver a contract, and as with anything, if you don't sign up to deliver the contract, there's issues with doing that. Now, I know some people, and particularly lay people, public and stuff that are watching, is thinking, what on earth are they talking about? Why are they talking about this? Surely you just want to do it. We do. Absolutely, we want to support our patients and practices and that, delivering this vaccination, because we hope by doing that we can get back to normalcy. But the thing is, you have to make sure you can do it sustainably. You have to be able to, you can do it logistically, and there are some places where that's not possible. Just again, we talked about room sizes, staffing. You just don't have the ability to do it. And then making sure you can maintain and deliver it, because you don't want to start doing something and realize that actually partway through we can't do it, and then that causes more upset, more challenges, and more difficulties. And the finance has been discussed. I know a few people feel that the funding for it is not appropriate, particularly since they have been giving so much funding to various other things. And then if you work out the resources that general practice gets in order to deliver the vaccination, does it or doesn't it? Is it enough to help deliver this at scale in your local area? Well, it depends on so many different variables. And I think that's the reason why some places have said, no, we can't do it. I think the 15-minute wait time coming back in, that massively changed a lot of things. So shortly afterwards, I know, although the sign-up was Monday evening, as you mentioned there, Paul's reported that since then, some areas have turned down, asked to leave the enhanced service because of the 15-minute wait time. And that's just because the plans they had and locations they had and stuff don't fit with the new requirements. And that has to be recognized, that if you can't deliver the vaccine the way it's meant to be delivered, then you can't deliver it. I think one thing we need to be clear on is that doesn't mean patients won't get vaccinated. That will still happen. It'll just happen in a different way, and it may not be, as we said throughout this, at your local practice.
Yeah, no, absolutely. I think it's a really complicated issue, and you're right. It's difficult for the general public to get their head around it sometimes. The few key things for me here are so one, general practices are actually small and medium-sized businesses that need to be sustainable as businesses. They're not actually directly funded parts of the NHS. General practice absolutely wants to help, but as well as delivering the vaccine, general practice also has to deliver on the other elements of its contract, the other things that it needs to do in terms of providing some acute care, providing long-term care, and, being a place where people will go with their cancer red flag symptoms, and people need essential assessment and referral, and that needs to continue at the same time as delivering the COVID vaccination. So people have to look at the whole picture of keeping their business running so they can be there. So there is some consideration of the financial envelope of this whole thing, and they need to be able to do the other things that they need to do as well as delivering the COVID vaccine. And actually, if they don't sign up to deliver the COVID vaccine, the responsibility for vaccinating the patients remains with NHS England, and they will find another way to do it. And I think the key things where people had reservations, for me, you've mentioned a few of them. The 15-minute wait, I think, is an issue. But actually, in signing up to the enhanced service, practices are signing up to something which can be changed after the event, which a lot of practices were very nervous about, because you have to give 6 weeks to exit the contract, but can be changed. Anything in it can be changed by NHS England at the drop of a hat. You're actually signing up to say that if it's necessary, you will deliver 8 in the morning till 8 at night, and 7-day-a-week vaccinations. And that you will provide, that you will be responsible for storing the vaccine, of the vaccine stock. There's actually quite a lot of big asks in there, in many areas, including Nottingham, and we'll probably talk about our local experience in a second. We're going to share those responsibilities with our other practices, and actually, more importantly, with the wider system. So those burdens won't fall on general practice in entirety in our area. But it's a big ask to sign up for. If you're just a practice on your own, or a small PCN in a rural area, it's really hard to actually say that you can deliver that. And that's what you're saying when you sign up. So I've got a lot of sympathy for practices and areas who just felt that they couldn't sign it because they couldn't say that they could deliver it. And that's how I see it. It's interesting. But what about our local experience then, Gandhi? How did you find the experience of signing up locally in Nottinghamshire?
Well, it was all a bit tense, wasn't it, Andy?
It was the most tense kind of bit of negotiation and politicking that I think I've experienced for a while so far. Yeah, that was tense. Yeah, sorry, carry on.
I think, it was really interesting, wasn't it? So the information about signing up, we had a week to sign up. And let's be honest, it wasn't even a full week. It came out Tuesday evening. You had to sign up by Monday evening by midnight, which actually meant you had to sign up by about 5 o'clock because the CCG office is shut before then. So you kind of have to send it beforehand. There was the weekend in the middle of that. So it's harder to meet and trying to discuss and understand the implications, what it meant, what it didn't mean. I think for us, the challenge was that actually before the enhanced service came out, we had a really good collaborative local plan agreed that looked really sensible. Everybody was signed up to. It would mean that our patients got vaccinated, effectively. There was plans for dealing with every possible potential outcome, and everybody had signed up to that. And the initial thing that we were advised is by signing up to the potential enhanced service may actually make that process worse. And then when the clarity of what the enhanced service actually meant and the funding routes became a bit clearer, actually there was that problem in the fact we didn't know what that meant for the funding for the local plan. And as a result of that, we were then stuck with, do you sign up and potentially bring more resources to the system to help vaccinate patients? And what does that mean? And what does that mean if you really can't deliver in the same way that is expected? And all those complexities came into play. And it was on the wire. I think most people decided on Monday itself, partly supported by our local LMC. Hats off to them. They ran an amazing event on Monday at 12 o'clock, supporting practice to explain a lot of the information, the pros, the cons, and where we were and all the other kind of stuff. And I think that really helped people to have a bit more clarity. Hats off to Michael and the team that did that. And I think there was some reassurances given in terms of what it meant. And then, practices in the whole site, I think it was 94%, 92%, something like that across Nottinghamshire. So that's the entire kind of Nottinghamshire CCG area, 92%, I think it was, sign up is pretty impressive.
Yeah, I agree. I think it was a really interesting process. And I think actually you're right. The local parts of the system worked really well together in Nottinghamshire. There was a great local plan already in place that we were able to work together within what people called a blended approach now, which is what's going to be delivered across most of Nottinghamshire. And the LMC were really responsive. They've got a unique role to play, haven't they? Because they're sort of semi-independent. They're good kind of arbitrators of discussion and facilitators of discussion and mediators. So they organised that great meeting on Monday. I think the CCG were and the locality team were really good as well. Our CCG provided a letter of support for this blended approach, which obviously they can't, underwrite some of these risks to general practice in terms of, what they are signing up for in the contract. But the sentiment was really clear that the CCG are absolutely behind a joint and blended approach in Nottingham. That was really helpful. So Stephen Short, chair of the CCG, was really helpful. And and I think that sort of strong. And also, I think the relationships that have been built over the past 18 months through primary care networks were really, really key as well, because what we did, which we would have not really been able to before, is, you know, we attended the LMC meeting, and then we arranged a PCN Zoom meeting afterwards. So all of the practices actually then hopped on a Zoom meeting, and we talked about things for another 45 minutes. And then we all signed up. But, you know, had we not been able to do that, I'm sure a few of our practices might not have made the deadline, you know, but we had the PCN infrastructure to communicate with practices and just sort of shepherd them towards making what decision they felt was right for them, because it was a practice decision, but just making sure that they made the decision by the deadline, which I think under normal circumstances would have been a challenge in and of itself. So yeah, so really interesting experience.
And I think there's something to be said about the CCG being supportive of the local plans. Don't get me wrong, I've had gripes with our CCG in the past, and probably will do at some point in the future again, because that's just the nature of contractor versus provider kind of thing. But compared to what I've heard in some areas of the country, well, they've definitely been a lot better. You know, I've heard very negative stuff about some areas where they have been very punitive and threatening to practices that haven't signed up. And let's be clear, this is a practice decision. It was optional. There is no mandated requirement for practices who have signed up to the enhanced service, and any organization trying to, you know, do such a thing, to be honest, you're being very wrong. And, you know, if any practices out there have had that experience, we're keen to hear from you. But I think, you know, that's something that thankfully we've not experienced with this. It was still supported that this was a practice decision, and regardless of what practice decided, that there would be support there to help manage the situation, which was nice.
Yeah. So
shout out to them for a positive thing.
Yeah. So it's probably been a formative experience for the system in Nottinghamshire, actually. And it was nice to hear from colleagues outside of Nottingham City, which we don't always do, but it was nice to have a bit of engagement with them as well through the LMC process. Yeah. So the only other thing on our list, Gandhi, was just, I think, to highlight some of the documents that have just sort of breaking and coming out. So
back on. Yeah.
A lot of people were concerned that, and actually your experience of being consented was that it was a PSD sort of process, a patient specific directive. Yeah. And actually maybe we should explain a little bit what a PSD and a PGD is. So I'm going to have a go and you're going to correct me, Gandhi. Okay. So
yeah, sure.
So whenever things are delivered by, and I believe it's by non-prescribers, particularly in the context of vaccinations. So what we say applies to a lot of the vaccinations that are done routinely in general practice. There are two ways in which it can be delivered, and one is a PSD, patient-specific directive, and that means that a prescriber needs to be, it might even be a GP, you can correct me, needs to be in the loop on each and every time that treatment is delivered. And it's called a PGD, a patient group directive, which means that actually that clinician can approve the delivery of that treatment or vaccination for a specified group of patients and doesn't need to be involved individually. You're nodding, so hopefully I've got that relatively right. Yeah. So there were concerns, weren't there? That, well, initially the vaccination had to be delivered on a PSD, which meant that the process was a bit more arduous, and you had to speak to a prescribing clinician, a doctor, and a consultant, I think you said in your case, to authorize you to have that jab, and everybody having the jab that day had to go through the same process. But now NHS England have released a PGD, which should streamline the process no end. So how will it be different under a PGD, do you see, Gandhi?
So the key thing is that it streamlines the process. So I mentioned that when I went in, I got my COVID symptom check. Are you okay to come in? I got my consent process done by a clinician. And then I had the prescription consent process, which was the PSD part done. And then I had my jab. So I had 4 steps before I managed to actually have my vaccination. Then I obviously had to wait around afterwards. The benefit of the PGDs, it removes that prescribing step. And the 2 benefits of that is, 1, you take out a step, so you make it logistically easier and less time. And that's a massive thing, particularly if you have to stick around for the wait time. But additionally with that, you open up the possibilities of who can deliver it, and you reduce the cost to deliver it, because you no longer have to pay to have a prescribing member of staff have a contact with every single person that needs a vaccination. And particularly when you're trying to deliver it on a wider scale, that makes the process so much easier. So the fact that PGD's out is great. I think it's what a lot of people have been waiting for, because if the PSD process was going to continue, it makes it so much more complicated. I've not had an answer as to why it's taken so long to get the PGD out. Now, I appreciate new vaccine, new world, completely new process, and I'm sure there's regulatory hoops that I am not aware of, that you're not aware of, all that kind of stuff. But it sounds like it's a piece of paperwork, to be honest, to me. But again, we're not involved in that process. We're not aware of the logistical challenges and stuff that go into it. And if there is anybody watching that could tell us that, I'd be really keen to know why. But I just don't understand why the PGD couldn't be available from day one, because it caused a lot of concern for many places delivering this. They were really worried about how logistically they're going to have to do this, and the costings and the workflow and the streamlining of patients through the system. It made a massive problem because the PGD wasn't available from day one.
I don't have the answer. If anyone does, as you say, let us know. So that's probably all the sort of news and updates I think we had, apart from one last thing, which is a lot of people have been concerned about how clunky the consent process is. And, and you found it a bit anxiety inducing going through the consent process. Yep. And I might as well, because I felt similar when I've been consented for procedures before. What could we possibly do to maybe make that process easier, particularly as the scale of what is happening is ramped up? Have you done anything to help, perhaps, Gandhi?
Yeah, lovely little segue there, Andy. So just to suggest, so I've created a video in collaboration with Primary Care IT to try and support the consent process for patients, and for also to share, I guess, the information about the COVID vaccination. So feel free to have a look at it. We'll stick the links down below once we finish this episode and stuff. But it's basically a short video that goes through the consent, that what you need to know about the COVID-19 vaccination process, and then specifically about the Pfizer vaccine. And once the future vaccines come online, we'll also create those, but obviously we're waiting for the information about those, so we can't have that available yet. But why? Simply put, sharing that information before the process, I think, gives people the ability to have a better informed consent, so they're aware of what's going to happen. So hopefully some of those questions get answered and it's a bit more streamlined, and it means that you can actually then just know what you're getting into a lot earlier, rather than getting to that point and then thinking, oh, do I want this? Do I not want this? And that anxiety that potentially is driven by that process. So yeah, hopefully find it's something that people find useful and effective. And it's really interesting because this is something that I kind of expected, but until it happened, I wasn't realizing. Often most of the videos that we produce generally get quite a few likes and not really many dislikes. I think because this is about the vaccination, it's pretty much 50-50.
Controversial topic.
Yeah, so it's a controversial topic, and I think it's going to be
comments off potentially.
No, I'm happy to respond to comments, so I've left them on, and I've already had some negative ones, but people have their views, and I'm happy to engage in terms of what that means and stuff. But very clear, the information in there is just simply the information that has been provided, and again, that information may change over time, so I've had to make sure that was there. It was one of the hardest videos to record ever, I must admit, and hopefully you'll all see why when you watch it and things. But lots of information there that I think is going to be really useful, and for practices, network areas, that kind of stuff. If you want to share it, go for it. It's there for you to use to support your patients. That's the whole reason we've created it, like some of our other stuff. Yeah,
it's sending people a hyperlink via text message on their phone so that they can watch something like this, before they come along for their vaccine, I think is a really, really good move, because it gives them a little bit more time with the material. They might come up with some additional questions that they want to ask when they actually come for their vaccine. So I think anything that does that is great, and I think we should see more of this in the future, actually, for consent, for particularly things like vaccinations, but possibly other treatments as well. Gandhi, just one last question. I know we need to finish soon. So you often wear your glasses in videos. In the video, you're not wearing your glasses. What was behind that decision?
It was simply just shine from the light. I couldn't get it to work, so the easiest thing was just to take my glasses off.
Not an attack of vanity or anything. Okay.
No, nothing at all. It was just purely because the light kept shining into the reflection of my glasses. So I tried numerous ways. Like I said, this was probably one of the most logistically difficult videos I've ever done to shoot, and it was just because it was a bit distracting for me when I tried it the first time. So I thought the quickest way to fix that was to take my glasses off, which I must admit I didn't like, but it was the easiest way to make it work.
Fair enough. Yeah. Okay, good. So that probably brings us to the end of the episode, I guess. Hopefully it's been informative for people. We do have a few things coming up over the Christmas period. We've got some special episodes coming up. So
absolutely.
I'm not quite sure in which order these are going to be going out. So I'm just going to let Gandhi say what two sort of special episodes we have coming up.
Yeah, so clearly in 2 weeks' time, when we would normally go live, is going to be Christmas Day. So we will be clear, we are not going live on Christmas Day. I'm pretty sure none of you want to join us at that time, and we want to spend time with our family and stuff as well. So instead, what we're going to be doing is, for the next 2 weeks, you'll have an episode where it's me and Andy kind of recapping 2020. So definitely join us for that, and that's going to be our awards ceremony, where we're going to be giving out some amazing awards, including the top 5 tech things to happen in primary care in the past year, as well as our most innovative award and our most disruptive award to general practice. So make sure you join us for that. And in addition, we're doing our regular annual kind of tradition of hosting an episode with another kind of podcast or group and stuff. And we've invited Ben Gowland from the General Practice podcast to join us again. Last year, we made some interesting thoughts and predictions and hopes of what the year would look like for 2020. And we're going to recap whether or not we kind of got it right or wrong, and see what 2021 potentially holds for us from our perspective. So join us for that as well, because it's going to be a fun episode.
So some fun upbeat episodes coming up, hopefully, to give you all a little bit of Christmas cheer, and then we'll hit the ground running for 2021. So so hopefully see you all in those episodes.
Absolutely. And as always, EGP learners, leave us any comments, questions. We'd love to know what you thought of this particular episode and some of the stuff we've asked. And EGP Learning is always here to help save you and your patients time by taking hands in your primary care and learning. And we will catch you in the next episode.
Bye.